Welcome back to Therapy Thursdays on Louisiana Living. I'm Angela Yarborough, Dr. Jerry Yarborough with Physical Therapy and Balance Centers. And today we're going to be talking about strokes. A stroke is when you have lack of blood flow or decreased blood flow to the brain.
That's right. There's three different types of strokes. The first one is called an ischemic stroke, and that's where the blood is prevented from flowing. Now, blood can be prevented from flowing starting off by plaque being built up in your arteries, and that plaque may break off and then clog up that artery, so it stops the blood flow. Now, this is the one that's the most important. Really, any stroke, is very important that you seek medical attention immediately. But with a clot, if you get to the hospital really quick, they may be able to give you some medicine called TPA, and that can help dissolve that clot and decrease the negative effects that you would have. The second type of stroke is called a hemorrhagic stroke, and that's where the artery has burst, okay? And you're bleeding freely in your brain. So it's very important that they stop that bleeding ASAP, because not only are you getting a lack of blood flow to your brain, which of course is carrying the oxygen for your brain to function, you're getting pressure built up inside your brain. So again, any stroke, you have to get immediate attention. Then the third type of stroke is called a TIA, or transient ischemic attack. And that's like a mini stroke. It's just a temporary occlusion, and it opens back up. So you could have temporary symptoms that don't last very long. They could last for, just minutes or hours, and then they go away. That is still extremely important that you get medical attention, because the TIAs are normally precursors to a major stroke. So why don't you tell them the symptoms of a stroke?
Well, some of the symptoms are, like if you have a headache, like the worst headache of your life, like get to the ER immediately, get help. You could have facial droop on one side or both, and then you can have slurred speech. Yeah,
you can have weakness in like one side of your body. Normally a stroke is going to happen on one side of your body or the other. And if it's in the right side, then your left side is affected. And if it's in the left side, your right side is affected. And depends on the severity of how much it's affected, whether it's hemiparesis, just weakness, or hemiplegia, which is extremely affected motor function. And then, some other symptoms may be, loss of consciousness, tingling, numbness. Any of those symptoms, you need to get to the ER ASAP. It's extremely important. Now, so some contributing factors to people having a stroke would be smokers, if you have diabetes, if you have high cholesterol, the bad cholesterol. That's what builds up that plaque in your arteries. Hypertension or high blood pressure. All of those things can be contributing factors to you being predisposed to having a stroke. And some things that you can do immediately to start decreasing your chances of having a stroke is to exercise regularly, to practice relaxation techniques to decrease your stress, decreasing your hypertension, eating healthy, controlling your diabetes. Those are just a few things that you can start immediately to help reduce your risk of having a stroke. So why don't y'all come back in the next segment, and we'll talk about some treatments and how physical therapy can help those that have suffered a stroke.